section you're going to learn all about the scar management. Scarring for C-sections, or scarring from an episiotomy, so the planned cut, planned incision, or from a natural tear. If you have had a natural tear, grade 3 or 4, you should have been informed and referred to the women's health physios at the maternity hospital. So perhaps if you have had that, maybe you can just ensure that that referral is in place. Generally for grade 1 to 2, they don't tend to do that. Okay, but it's fine, and this advice will help you out. The same principles apply for both, but we'll just be working on different areas, and I'll kind of flip between the two. Scarring is an essential part of healing. So just like if you got an outside cut, okay, so I don't know why, but if I cut my arm, okay, you're going to bleed first, correct? And then a kind of a flimsy little scar will be formed over, scab will be formed over it, and that looks different, doesn't it, to normal skin. And that scab over time becomes a little bit more firmer and solid, and the tissue underneath starts to knit back together. And then after another little while, the scab itself actually falls off, and the tissue underneath is fairly close to normal, but often a bit red and maybe sometimes has a little mark on it. Sometimes that doesn't go away. Some people heal differently as well. Some people will be left with a kind of a raised type scar, and that can be gene determined, and sometimes it's just depending on the procedure and the way that it was done as to how it might heal. So all of that process will happen with us all, and it's likely that the healing process happens, the scar process happens, and the tissue gets back to normal and you've no issues. In some cases though, you can struggle with maybe sensitivity of these scars. Sensitivity, or sometimes lack of sensitivity, lack of sensation. Because not only is the skin and the tissues underneath, let's say, cut or torn, but there's nerves that are there too, and they have to transmit messages all the time. And as they regrow or sprout, they can either become quite extra sensitive because they're not really sure about this new environment, or they can be less sensitive and you can be left with a numbness. So the first techniques that I'm going to do are going to cover that first aspect of it, and then the next set of techniques will be more about getting the scars mobile, because another thing that can happen is that we're kind of have what we call adhesions, or the scar maybe doesn't turn out to be like that normal skin again, nice and pliable and mobile and just as it was before, but instead the tissue is a bit stuck, a bit rigid, a bit less mobile. So the desensitizing work first. So this is to encourage the nerves to pick up messages, more normal messages again, or to start to learn what normal is, if you like. So you'll need a few different bits and bobs for this, and really it's just materials of varying textures. So I have things that I have in my clinic. So I have a tissue, I have a kind of a rubbery, well, it's a latex glove, and a face glove, okay, which has kind of bobbles on it and ridges, and it's old, so it's not so soft. And I'm going to use my t-shirt, which is 100% cotton as well, so it's quite soft. You might have other things like zips or Velcro or cotton wool as well. I'll just demonstrate with these. Okay, so my scar is going to be the ridge of my clothes here, okay, the ridge of my t-shirt. Now you're going to be, if we're talking about C-section, you're going to be fully rested down, or you know, maybe fully rested down, or maybe actually sitting up completely, but you kind of need to be able to see what you're doing really. So we would maybe start even just with the finger, And first, just kind of test the area. So, like, do you have full sensation? Do you have any EBGB sensation, as I call it? When you go just across the line of the scar like that, when you go, what's that, perpendicular to the scar, if it feels fine, it feels fine. You probably don't need to continue on with this route. But if it feels maybe numb or extra sensitive, and perhaps it's only in some areas, then you would keep repeating this rubbing kind of action. I'm going very light, and often it's the light sensation that tends to be more problematic for people. Okay, so very light. And if it's a numb thing, you would make sure that you have touched another part of your body, so the brain can start to create a bit of a memory or an awareness of, okay, that's what it's supposed to feel like, and now this is what we're trying to train. So either side of the scar, it might be that you have, you know, sensation, no sensation, sensation and sensation, no sensation, and sensation. So it will start to create that new image, that new memory. And then we might move on to a kind of a soft tissue, maybe folded, maybe not, because sometimes the really, really light things are the harder things to deal with. But you want to be in your kind of comfort zone. So you need to be, you know, like at the edge of what feels kind of, ooh, you know, a bit like that, but not really pushing through it. So I'm just working over this area so you can see, and let's pretend that that's my more sensitive area of the scar. About 5 to 10 minutes every day is recommended for this. And then it might be that actually tissue feels fine now, and okay, I know that's tissue, and that I'm getting some image from my brain, I'm getting some feeling from either side. And then the scar starts to be able to perceive and be comfortable and tolerant of that texture. And then you would go to something different, so the rubbery kind of feeling, and maybe with like more firmness, like if it's actually on the hand, and sometimes that kind of the noise associated with that isn't too pleasant for some people. And I'm only very light, you can see here. And then we would progress to doing different textures. Okay, so I'm going kind of with the rough towel. Then you might, as I said, use Velcro or like hairbrush bristles. You could kind of like press them lightly down into it. And the same goes for the perineal area. So you would do the exact same techniques on that area. So you do, or your partner to help. It's slightly a bit more awkward, but you know, you can get access to there. 5 to 10 minutes every day. If you can't bear to go near the area, if it's just too much for you, you could stay away from it to start with and do the work, let's say like above the scar or on the inner part of the thigh. If even that kind of is a bit too much for you, I'd suggest that you do seek some women's health physio advice and have a consultation, because there is a lot of things that we can help with to help you work to be able to eventually get access to that scar and to that area. It is very important that you don't kind of just think, oh, you know, I'll get used to it in time. If you're seeing signs of maybe that apprehension over the area or fear or being put off either perineum or C-section scar, do get in touch. And now we're going to move on to more the mobilizing of the scar tissue. So this would be done really from 6 weeks on, 8 weeks on potentially. You have to be sure that the wound has healed, so that the public health nurse has come out and checked that, or your GP has, or your physio has, that there's no signs of infection there, that the stitches are all dissolved or taken out, and they're, you know, the healing process is moving along nicely. So after you've become tolerant of the touch and of that kind of looking at the area, you can move on to this. So this is to help, if we think of the thing on our hand again, after that kind of outside scab falls off and the tissue just, it kind of looks similar but not quite, and it's maybe a little bit bumpy, it's to try to reorganize the collagen, the little scar tissue bits that are laid down. Okay, so I'm going to come back into this position again. My legs are out straight just so that you guys can see, but actually you probably would do this with the knees bent up. Okay, so my scar, okay, and of course you're inside the clothing, but I'm kind of using just the contrasting colour here so that you can see. So the edge of the green is going to be my C-section scar, and I would start above and below the scar with this. So we're above and below, and with this you're pressing in, you know, I'd say I'm a centimetre if not more in. Now of course it may be that your tolerance won't let you go that deep, so it may be that you're still working on the desensitizing. And I'm making small circles all the way along. I'm going to couple of circles, move on a point, a couple of circles, and I'm getting a feel for if there's any kind of thickenings or things that are a bit, that feels a little bit pinchy as you come onto it. So you go all the way above, and then you're going to go underneath, and you make the little circles all the way underneath. Okay, so if I come closer, it's this sort of action. Okay, now I'm not doing this, I'm moving the tissues underneath my finger. Okay, you might want to reinforce with the second finger, or you could do a bigger area. And you can see, can't you hear, as I pull the skin there, like how much pull it has to happen elsewhere. So it is important for good mobility of the whole pelvis and spine that everything gets back to its normal. Okay, and then the next technique would be starting to pull apart. So again, you're either side of the scar, pulling apart, pulling apart, pulling apart, pulling apart, pulling apart. Ooh, there might be a bit stuck there, you'd spend a little bit longer. I can only show this with one hand here, but like I was doing this, but what you might do here is pull apart, pull apart. And my fingers are staying on, but I'm trying to pull the center. And you might even keep the pull on and wriggle a little. Okay, so if I come to here, and if I go either side of the stitches there, you pull apart. So push in and pull apart, push in and pull apart. Here in the perineum, generally the episiotomy kind of would have gone from the vaginal opening out to the side. A natural tear tends to go a bit more straight. So depending on where you are, the circles would be kind of like that, the pull apart or the pull apart. Yeah, this guy doesn't really move, but just so you get the idea. Okay. And then once you kind of can tolerate either side of the scar, you then want to work right on the scar. So right on the scar, making the circles. Okay, we're pulling apart really close, and also going across the scar. So I'll put my scar back up to here. Rubbing across. And I'm on the scar now. It's actually, okay, so let's say this is, the stitches are actually my scar, rubbing on the scar. And then if you find a stiff bit, you keep rubbing. But again, I'm not sliding my finger on the tissue, I'm on it like this. Okay? You don't really need to use any creams or oils for this. I personally find that if you've got the cream and oil, your fingers slip on the skin more, and you're not really going to get the manipulation of the inside tissues that you're looking for. However, after having done it, it can be nice to rub bio oil or vitamin E cream, or any of the other recommended, to kind of massage into the skin. But this technique really we're working on the from the skin, the scar tissue that goes from the skin to the body fat, and then any adhesions that might be in deeper. So I've only gone, as I said, 1 centimetre or so in there, but then as you start to feel, okay, outside is feeling good now, but perhaps there's a drag higher up, it might be that you have to really go quite deep in, like, and especially in the center, and like you're not looking necessarily to get all the way into the uterus. So of course we've a lot of layers before that, but if there's any sort of stuck, these fibrous things that can sort of blend from the outside scarring, you're looking to generally massage all of that. And this can be quite nice in general, because like if there's any, if we're kind of feeling a bit bloated or full of wind, if you're massaging into the tummy in general, that is going to get some of the intestinal activated as well. All right, so desensitizing work you can kind of do from once you can tolerate it, so you could even do that from week sort of 3 or 4, so long as there's no sign of any infection and you're using clean hands. And then the actual manipulation or mobilizing of the outside scar and the tissues underneath from 6 weeks, again provided that you've had clearance, that the tissue is looking like it's healing well. And the healing process isn't over at 6 weeks, so don't think that 6 weeks now everything is healed. You're starting this procedure at 6 weeks, but you're still going to have different sensations there and different changes in all of the scar tissue in there for 6 months or so after the incision or the tears have happened. Talked a lot about it with regards to the C-section, or demonstrated, but remember the perineum, the perineal area, the same principles apply.